Hello everyone, on behalf of Ankura Hospital, Gachibowli, we welcome you to today's webinar on the occasion of National Nutrition Month. They say that a healthy outside is heavily influenced by how healthy are you inside. For a mother and a child, nutrition is very important. In fact, this is what distinguishes their health from the rest of us. And on the occasion of the National Nutrition Month, today let us look at the importance of nutrition for a mother and child. To begin with, let me ask Dr. Anubha, who is along with Dr. Jyotsna as panelists today to discuss about the importance of nutrition. Dr. Anubha is the consultant dietitian at Ankura Hospital. Dr. Anubha, please tell us what is the relevance of the National Nutrition Month and why are we celebrating it in the month of September?
Thank you so much, sir, for the question. National Nutrition Month started in 1975 and it was an initiative by American Dietetic Association to start this. And they started it out as a week, and then because it became so popular, everybody really enjoyed what the awareness it was bringing out along with the message that was going. So in 1980, they made it not only a week, one full month of celebration and creating awareness about what is good for you to eat, what you should be eating, how you should be exercising, and how your diet and whole lifestyle should be. In around 1982, India also adopted this, and since then we have been celebrating this every year in the month of September.
Thank you, Dr. Anubha. It's very important that we recognize the importance of nutrition, and having an entire month focusing on the importance of it in both mother and child helps us get the perspective back on nutrition. And it's very important to know that this determines the survival of the baby in utero, and also a lot of the growth of the child in the early years is determined by the amount of nutrition that the child takes. So let's go through the importance of nutrition from the time the mother is pregnant. If we realize pregnancy is the period when the mother is having an additional requirement and she needs to cater to not just herself but also the growing child in her. And a lot of the child's health at the time of birth is heavily influenced by the amount of nutrition that the mother takes. And it's not easy. The reason being, many of the mothers experience nausea in the first trimester, and it is not a very comfortable time for the mother to eat more, but at the same time she has the responsibility to address the additional nutritional needs of the growing embryo. So Dr. Jyotsna, please tell us what is the importance of nutrition in pregnancy and what are the additional needs that a mother needs to cater to.
Thank you, Dr. Sri Krishna. I think it's a very relevant session that we are having today about nutrition and creating awareness about nutrition, especially in pregnancy and in breastfeeding mothers. So when you ask me a question about special nutritional needs in pregnancy, I would like to first mention that definitely we know we need to have excess a little extra calories for the mother who's expecting a child compared to a non-pregnant woman. In the first 3 months, it's not really necessary to increase your caloric intake, and also with the nausea and vomiting that women have, it's a little difficult to increase the caloric intake. But from the second trimester onwards, there is definitely a need to increase the total amount of calories that woman consumes in pregnancy from whatever the non-pregnant state requires in a balanced nutrition to an extra of 350 calories in the second trimester and about 500 calories in the third trimester. So this is achieved by going through examination of what diet she is taking, making sure that all groups of nutrients, whether it is carbohydrates, proteins, fats, minerals, vitamins, everything is included in the balanced form, and she takes a nutrition with the food items which are nutrient dense. You can manage to give all the nutrition that is required while maintaining the caloric intake to the required amounts. So you should also remember that all groups of food items should come in a balanced form. So for this reason, we generally advocate that make one visit to a nutritionist during pregnancy to understand the nutrition needs according to trimester and take a personalized customized diet chart wherever possible. If not possible, there are enough resources online and in books that you can use to get this information about how to tailor make your diet for yourself and make sure that you eat safe, nutritious food.
Thank you, Dr. Jyotsna. So, pregnancy is a period where the mother has to take additional calories, and as you have said, ensure that she is taking nutrient dense food. And soon after birth is a much more tough scenario, because now the mother has to feed for herself to ensure that she has adequate nutrition to feed the baby, and we are advising 6 months of exclusive breastfeeding, and this saves the baby from infections and ensures that the baby has lesser allergies, lesser cancer as the baby grows up, and is also beneficial to the mother. So amongst so many requirements which are there in the period of lactation, how does the mother ensure that she is taking appropriate diet? And often we have seen lots of myths around the initial 1 to 2 weeks wherein mothers are told to stay away from a few food items. So please let us know what is the additional requirement in lactation, what should be the ideal diet during the lactation period, and also your thoughts on these common myths that surround the early period where the mother needs to be off a few food.
As you rightly said, Dr. Sri Krishna, I think there is a lot of need to create awareness about the change in diet during lactation period. A breastfeeding mother certainly requires attention with regard to her food when she wants to produce sufficient amount of milk for the baby. And honestly speaking, from the pregnancy diet that she has been taking, there is not much of a change in the lactation. The basic principles of nutrition remain the same. She has to take nutrient dense food, include a lot of fruits, vegetables, whole grains, milk, and sufficient quantities of water in her diet so that she can produce milk. And we generally advise women who are breastfeeding to take foods which can increase milk secretion, which are technically called galactogogues. So foods like garlic, ginger, oatmeal and milk, etc. increase milk secretion and help the baby to receive sufficient nutrition during the breastfeeding years. So for this period of lactation, it is advised that the woman takes about 500 to 550 kilocalories more compared to a non-pregnant, non-lactating woman. This can be achieved again with a good professional advice about nutrition, or to evaluate their nutrition correctly and go through what they can or cannot include in their diet. Generally, there are no restrictions as to what foods you should avoid or take during lactation period, as long as it is not unhealthy and does not contain non-nutritious calorigenic food. I think we are good to go, but as I said, the galactogogues should be kept in mind and a sufficient amount of water and milk should be included in the diet. Another thing I would like to emphasize is that although there is no restriction on what you should or should not eat while breastfeeding and during pregnancy, definitely do not try to do any fad diets or weight loss diets and start cutting down calories simply to control your weight, and concentrate on nutritious food, adequate food, safe food, and make sure your baby gets the benefit of all your good nutrition through the breast milk.
Thank you, Dr. Jyotsna. I think it's very important to know that whatever you eat goes into your mouth, your esophagus, your stomach, and that's a different passage from where the breast milk is produced. So this common myth that many women have, and probably the grandmothers have, that what you eat heavily influences your breast milk, is just unfounded. The milk is produced in the mammary glands, and the production of milk is regulated by hormones, and these hormones have some positive and negative influencing factors. If any, it will be the amount of nutrition and the fluid intake that would determine this, but not really the type of food. And please understand that it's difficult for a mother to eat more when the food is not tasty and is very insipid. So request to all the grandmothers and also the mothers, please ensure that you are taking adequate nutrition, eat foods that you like, you are eating not just for yourself but also to ensure adequate milk for your own baby. So please ensure you take complete balanced diet with additional requirements that are necessary in the lactation period.
So, Shri Krishna sir, now that we have the baby already delivered, so we see that it is very important and always the emphasis is done on breastfeeding. So, can you enlighten us about what exactly or how important it is for a mother to do exclusive breastfeeding, and what are the challenges that are faced by a newborn, a new mother basically?
Yeah. Breastfeeding is the feeding for the baby. In fact, it's the only feeding which is allowed in the first 6 months. The baby has been in utero for the 9 months of the baby's life inside the mother's womb, and all the nutrition came directly from the mother. Now that the baby is separated from the mother, the baby needs nutrition, and this comes again from the mother itself. Couple of important points on breastfeeding. Ensure that the baby starts sucking on the breast, ideally on the labor table itself within the first 1 hour. And the reason being that the baby usually tends to fall asleep after the initial few moments of cry, and thereafter it becomes difficult to establish the suck and the remaining reflexes that are required for successful initiation of breastfeeding. So, early initiation of breastfeeding ideally on the labor table in the labor room is very, very important. In the initial few days, it's only a few drops of milk that comes out, and this is called the colostrum, which is very rich. Please do not discard this. Ensure that the baby gets these few drops. The baby does not need anything more than this for the first couple of hours, and in fact the baby's system is made sure that they have enough glucose in their body, so you do not have to aggressively feed the baby in the first 2-3 days. After the colostrum is done, then a successful train of breast milk then gets established. This is influenced by hormones and of course the mother's nutrition, and once the breastfeeding cycle has been established, most of the time the baby is able to feed on demand, and ensure that you are giving exclusive mother's milk till 6 months. In fact, the entire digestive system is tuned or wired such that it can only accept mother's milk ideally. So, anything else that you give, it will all mess up the system inside. So, please give only mother's milk for complete 6 months. So, this is exclusive breastfeeding till 6 months, and this ensures that the baby has lesser allergies, lesser infections, the growth is better, they are sharper, smarter when they grow up, and they have lesser problems when they become adults. So, the benefit of you breastfeeding your baby for the first 6 months with only mother's milk is not just the benefit in those 6 months, it stays all life. It also benefits the mother, it reduces cancer in the mother, increases the bonding between the mother and the child. So, breastfeeding for 6 months is beneficial to both of them. However, there are some common problems. The first one being that mothers find it difficult to make the baby latch on, and this happens when you delay the first latch on. If it is not happening in the labor room or in the labor table, then the baby gets dull and it's difficult to make the baby again get latched on. So, please ensure that you have early initiation. Some mothers have inverted nipples, and there are some medical measures in which we can ensure these concerns are addressed. Some of the mothers also do not feed in the correct position, wherein the way they hold the baby, looking at the baby, the position, all these are scientifically proven to be efficacious only in a certain position. So, make sure that you follow adequate positioning whenever you are feeding the baby, and also attachment, and these two terms, attachment and positioning, are very important to ensure successful breastfeeding. There are other minor issues that some mothers may face, like sore nipples, infection of the nipple area and the areola, and these require medical intervention. So, reach out to your doctor whenever there are medical concerns, but ensure that you put in all efforts to initiate breastfeeding within the first 1 hour and continue breastfeeding alone for the first 6 months. So, now that we have spoken about the journey of nutrition in the pregnancy, in the lactating mother, and also in the newborn at the time of birth and for the first 6 months, where we advise only mother's milk and nothing else. Now is the time when the baby is ready to accept nutrition other than mother's milk, and this gives rise to the phase where the child needs additional nutrition, and this is called the complementary feeding. We have Dr. Anjul Dayal, the head of the PICU and consultant pediatrician at Ankura Hospital, Gachibowli, to tell us more about complementary feeding. Dr. Anjul, please tell us 5 key points related to complementary feeding, which is to be initiated after 6 completed months.
Thanks, Dr. Sri Krishna. I think it's a very important question that we are addressing now about the complementary feeding, which is feeding that we start at 6 months after the child has been exclusively breastfed by the mother for the first 6 months. And complementary feeding actually has a lot of nuances over there, because there's a lot of confusion on what do we start. So I think we will just talk about the principles of the complementary feeding, what we are going to give those points so that the mothers understand what they will be feeding the child. So the few things that we have to understand: one, it's always better that we start the food which is homemade. Freshly prepared food is always better than the commercial preparations. Although commercial preparations are not bad, there are multiple of them which are available in the market, but homemade food which is given to the baby is always better. Always start with a consistency which is equal to the breast milk, that is, it should be in the liquid form to start with, and then you can keep on increasing the consistency of the food. Start with a very small amounts, whatever the baby is taking. This is something called as a responsive feed, where you do not try to force the child to take the feeds. How much the child is taking, that is fine, because this is only a phase where we are just getting the child to get used to getting the food which is apart from the breast milk. Other important thing is always make sure that we give a certain amount of water to the baby after we have given the complementary feeding, so that it doesn't cause a choking or later a cough or the vomiting in the babies. Now the babies might not accept the food at first time when we are giving whichever food we are giving. For example, we are giving the mashed fruits, or we have started with the dal or water, or dal and rice khichdi in the form which is very diluted. But in case if they are not taking that particular food, always try to change the texture or change the food. At least you should try the same food 4 times before you say that the baby is not taking this particular food and switch on to the other food. Always start with 1 complementary feed a day initially, and then slowly build it up. By 6 months to another month and a half or 2 months, we should be able to reach 4 square meals a day. Even when we reach these 4 square meals, or in between that, we should ensure that the mother keeps on feeding the baby the breast milk, which is very important. And also, whenever we are trying to give the food, we have to make sure that the food is very balanced. We should have a bit of proteins, we should have minerals, vitamins. So Indian diet, if you look at that, the dal, the rice, the vegetables, the fruits, they are always very healthy, and they have usually an equal mix of nutrients there. So I think that is the principle that we should be following with the complementary feeds, and it is always a challenge. No one child will be having the same type of the food and behavior, even the twins, they are different. So always try and always enjoy that period of complementary feeding. I think that's the most important thing. Thank you.
We have seen the importance of breastfeeding and then complementary feeding as well. Now let us look at the nutrition of a 2-year-old. Now this year between 2 to 5 years, the preschool years are very important, because now the child is of mother's milk and slowly has started to accept homemade food. But the problem is that the child is growing, and not just in weight and height, but also in terms of his thinking. And now the child thinks he is as good as an adult. He is able to walk, run, he loves to explore the surroundings, and starts to say no, because he starts to have an opinion and takes a decision about things around him. So often we are in a state where the child says no to lots of stuff without even understanding the importance of it. So it's a very important phase, but there are some important caveats to this. The first 1 year, the child's birth weight would have been about 3 kgs, 2.5 kgs, and would have reached around 9 kgs. So would have picked up 6 to 7 kgs in the first 1 year. The next 1 year, probably another 3 to 4 kgs. But now from 2 to 5 years, these 3 years, each year the weight gain would be just 1 or 2 kgs, but not more. So the nutritional requirements are also going to be lesser. So do not compare the amount of feed and the frequency of feed of a 3-year-old with that of a 9-month or a 10-month-old. So their requirement is much lesser. Second, even the type of food that they take will be different. Suggestion is that you try to keep it as close to the food that you have as adults. In fact, after the age of around 12 to 15 months, we suggest family pot feeding, which means the whole family just takes one type of meal. So you stop making food for the sake of children, make food for the family. And it's also family feeding, which means the entire family eats together at once. This is very important. The only way in which you can ensure they listen to you, understand the importance, is when you follow the same. So please sit with your child, cook the same type of food that you would do for yourself, probably a little less spicy or to suit their palate, but then eat it along with them. And it has to be a balanced diet and in adequate portions. Most of the time, the kind of diet that you take with a good breakfast, lunch, a snack in the evening and then dinner with adequate amount of water through the day is what a ideal diet for a preschool child is, between 2 to 5 years. Probably the quantity is a little less compared to what an adult takes, but it has to be balanced in proportion and ensure that there is diversity and variety in the food that you take. Next, we reach the segment of an adolescent, and this is a very tough phase, especially so nowadays where there's a lot of access to information and there is more access to different types of foods. And it's always a challenge for parents to feed an adolescent because they come with a preconceived notion about themselves. They have strong thoughts about their body image, and apart from this, they have a requirement of additional nutrition because there is also the pubertal phase where growth happens, and it is important for them to also focus on their studies at school. So it's very important to have the right nutrition for an adolescent. Dr. Anubha, what would be the right nutrition for an adolescent, and if you could tell us what issues do they face and how do parents address them?
Thank you so much, sir, for the question. Well, as you rightly said, that the requirement again starts to increase during the adolescent time. Now they have more growth spurt. Now hormonal changes are going to be there. Girls start their periods and boys also, they are maturing very fast. So the demand is very, very high and the inclination is very high towards the junk food. It is not only because of the peer and the advertisement and the social media awareness and the access that they have, but also because they are now so much aware that when I ask for a food, it would be given to me. All those that were set by the parents, all the rules, the ground rules that were set by the parents, slowly and gradually the rebellious nature of the teenagers starts setting in. So this is the time where we really need to maybe sit down with the children and talk to them, make them understand the importance of nutrition at this time. So what we need to do here is focus a lot on the proteins, as we know that proteins are very important for the growth and development of the child. Protein is something that should be included in each and every meal, whether you're vegetarian, whether you're a non-vegetarian, all kinds of proteins are good for you. Also, high iron should be included. So iron rich foods, green leafy vegetables, some black raisins, dates, these are things that should be definitely included in everybody's diet. Along with that, carbohydrate requirement also increases. So when we see that complex carbohydrates are something that should be included in the child's diet, like whole grains, some of them also have a lot of fancy towards fast food like maybe pasta or pizzas, but we can make that healthy at home. We can use alternatives and we can use them and make them at home and yet make it palatable and tasty for them. It's okay to eat a little bit of junk food or a little bit of sweets and sugary drinks once in a while, but we can always put a discipline that maybe once a week, one meal can be had outside, or we can call in the food, but not on a regular basis. That's what is my take on the adolescent diet.
Thank you, Dr. Anubha. It's very important that we adapt ourselves to the needs of an adolescent. He is changing. every year in terms of his growth, his understanding, his thinking and perspective of society, and we need to adapt. You cannot ask him to come back to the old times. We need to adapt, and you have rightly pointed out some very important points. The quicker we learn these, implement these, the easier it is for the adolescent to adapt, and we need to find that middle ground, and I'm sure with experience most of the parents are able to do it. Don't forget, all parents have been adolescents at one point of time.
Yes.
So we've all done it to our parents. It's
Definitely.
probably time for us to realize how we have to now adjust the way our parents have adjusted and made us come
Feel
to this
welcomed.
state. Yes. Thank you, Dr. Anubha.
Thank you, sir. So once we have finished with the adolescent diet, a lot of mothers must be coming to you and must be saying, my child is not eating and I don't know how to handle this problem. So sir, what's the advice that you give to these parents, and how do you counsel them so that they can understand their child better and help them?
Yeah, it's a very common problem. My child doesn't eat is something that every mother is concerned. See, as a parent, we all want our kids to eat. Remember those days when your mother, before you stepped out, used to ask you to finish the meal, or would have asked you, did you have your breakfast? Would have asked you when you called at night, did you have your dinner? So it's a maternal or a paternal parental instinct to ask the child to eat, and if the child doesn't eat, it's always a worry for the parent. So first thing for the parents, yeah, we do understand your concern, and there's an approach for it, and not all of them have a problem, and we need to understand where exactly is the issue and then solve it. So the first approach is to decide whether the child is healthy or not. See, a child with tuberculosis, with typhoid, with cancer also doesn't have appetite. So first step as a clinician for us, the doctor needs to know whether the child is healthy or sick. A sick child would not have the required appetite, and it's difficult for a sick child to have the same nutrition as a healthy child. But majority of the parents come to us with the problem in a healthy child, in an otherwise healthy child. Then we look at what are called as comorbid conditions. For example, in India, it's very common to have worms in majority of the children. So the first step is to ensure that the child gets deworming, and these worms are there in the fingers, and many of the children don't have the adequate hand hygiene. They keep their fingers in their mouth without washing their hands. So often the worms are inside your body, and whatever you eat probably goes to them, and they reduce your appetite as well. So the first step is to ensure that deworming is done. Also look for micronutrient deficiencies. What it does is it tells you whether really the child is eating less. If the child were eating less, automatically there will be a deficiency, which is less amount of vitamins, minerals, proteins. So those changes would be apparent in the child. These are again a small segment. Majority of the children, at least the ones who come to us, are not really malnourished. So once you have ruled out sickness, ruled out micronutrient deficiencies, ruled out any major issues, now you're looking at a healthy child who's just not eating up to the expectation of the parent. So this last few words are very important. So the next step is to know what is the expectation of the parent, and then look at the complete diet of the child. What is the child getting in terms of quantity and also quality? So if the child is getting adequate amount of nutrition based on whatever the parent recalls and tells you, then it's actually the parent's perception that the child is not eating enough. Maybe the 2 rotis and 1 bowl of curry is really enough. When you calculate the diet and show the parent the number of calories the child is having, perhaps the parent gets convinced that this was the requirement and this is what my child is eating, so all is good. So please look at the parent's perspective. Now that all this is done and the parent tells you that it is truly less quantity of food that the child is taking, and the child is healthy and all the other issues are addressed, which I mentioned so far. Now you need to look at 2 aspects. One is to look at the quality of food and the quantity of food. When I say quality, I am looking at whether it is a balanced diet or not. Quantity, whether the child is having the portions which are required to ensure that the required calories are being met or not. Often the quantities are low, although quality most of the time is addressed. Now we come to how do we make the child eat. A lot of your appetite is based on not just the food alone. Now imagine you're looking at me now, I just give you let's say a biryani and ask you to eat. Isn't it very tough for you to just start eating? you might actually not be hungry right now, and I can't just expect you to gobble food just because I give it to you. Now imagine the thought of a child who has his own opinion on lots of things. So he is going to be really resistant to a sudden appearance of food in front of him asking him to eat. Now compare it to a scenario where I talk about food. I tell you how the biryani is prepared. The smell of biryani now comes into the room. I show you some visuals of it. And I also ask your help in making it with me. Now your involvement is a lot more. And in fact, this is what happens in restaurants as well. They show you the pictures of food just so that your appetite is stimulated. And all this is science because your special senses are involved. You see food, you taste food, you smell food, you touch food. So your special senses actually stimulate the appetite center in your brain. Often recall whether you're using the special senses of the child before the meal starts. When you directly get a plate of food in front of them, it doesn't get stimulated. So before you come to the table, ensure that the child smells food, tastes food, touches food, talks about food and sees food. Only then the brain will stimulate the appetite center and then the appetite starts. The second point is on the thali concept. A big bowl of biryani perhaps will not entice everyone. It's not a good idea to give one type of food for the whole meal. What do you like to have when you go to a restaurant? You want a starter, you want a little juice, I would say a soup, and then some roti, and then a curry, and then dessert. This is what is there as a requirement even for a child. So you need to give a thali to the child in each meal. Instead of expecting them to finish one big bowl of just dal rice, please have a little soup, a little roti, a curry, rice, and then finish it off with a sweet. And all this is again science, because when you start with liquid and a protein and then finish off with a dessert which is sweet, then the protein helps in creating more appetite at the early meal, and the sweet towards the end of the meal ensures that you have satiety. So all this is based on science. So please follow this. Ensure that you are not getting one bowl to your child. Get a plate. Get a plate with 4 or 5 different items, and it's not tough when you have a good plan and you involve the child in preparing this meal. The third one is to look at whether you're creating hunger in the child. Appetite is influenced by a lot of factors, and you need to see whether the child is actually hungry at this time. Hunger is stimulated when your muscles ask for glucose. So the child should have had adequate exercise. Secondly, there should be adequate gap between the last meal and this meal. If it's too soon, then the child will not ask for it, and it's now going to be a force feed. So ensure there is adequate gap. Lesser amount of junk food helps in you taking more meal. That is because the junk food creates a sense of satiety. Your stomach is full, but not necessarily with a balanced nutrients. So you tend to feel kind of full for a very long time. So the chips that you had at afternoon will actually affect the amount of food that you take in the night. So try to cut down on junk food. Try to follow the thali concept. Please stimulate by using the special senses of the child, and diversity in food. Every day you can't have the same food. Even a biryani would seem odd to you and you won't relish it if I give it to you every day. The same with the child as well. You can't have potato in the curry all day, every week. Try to change it and try to add more color, more texture, and more taste to the food by changing the type of vegetables, the dal, and also the type of carbohydrate that you use. And this variety or diversity is what will sustain interest in the child as well. So all these principles, when you put it into action, then you can assess whether your child actually has a problem or not. Often, this subset of patients or parents who come saying my child doesn't eat, perhaps are not following these principles of feeding. Do these, and then we will look into a very small minority of kids who genuinely have a problem and they require medical help and further evaluation. On the occasion of National Nutrition Month, we are very fortunate. We have had experts from the field of obstetrics, dietetics, and also pediatrics who were here with us to tell us about the importance of nutrition. Nutrition is what determines how much you grow and also the power of learning. And a lot of it depends upon the parents' understanding and attitude towards nutrition. And I am hoping that with this webinar, you are able to understand some key aspects related to mother and child nutrition. And I am hoping that this knowledge will help you become change agents for their nutrition. My sincere thanks to Dr. Jyotsna, Dr. Anjul and Dr. Anubha for sharing their expertise, and we wish all the parents a very happy time whenever you are feeding your child, and for all the mothers a very happy pregnancy and also lactation period. Thank you.